Good afternoon, ladies and gentlemen. Welcome to the government response to the Auditor General's two audit reports related to COVID-19 conference call. I would now like to turn the meeting over to Minister Patty Hajdu. Bonjour, mesdames et messieurs. Bienvenue à l'appel conférence de la réponse du gouvernement concernant les deux rapports de la vérificatrice générale reliés à la COVID-19. J'aimerais maintenant céder la parole au ministre Patty Hajdu. À vous la parole, Madame Hajdu. Please go ahead.
Merci. Bon après-midi. Je tiens à remercier la vérificatrice générale pour son rapport et ses recommandations. Le gouvernement fédéral accepte toutes les recommandations qui vont permettre au Canada de se préparer pour l'avenir. I want to thank the Auditor General for the latest report and recommendations, and the federal government accepts all the recommendations, which will ensure Canada is prepared for future public health events. As the Auditor General noted, I'll highlight the incredible work accomplished by public servants to quickly mobilize, secure, and distribute equipment and medical devices during the pandemic. The federal government has done everything in its power to secure equipment and medical devices to protect Canadians. This operation at a time of unprecedented global demand has been a vital part of Canada's response to COVID-19 and has helped provinces and territories meet the needs of citizens across the country. The report also demonstrates how Health Canada, the Public Health Agency of Canada, and Public Services and Procurement Canada mobilized resources around the clock, cut regulatory barriers, and modified procurement activities to quickly buy the equipment to respond to the pandemic. With investments of billions of dollars to help our country face surges in cases of COVID-19, the federal government has provided important funding and resources to protect its citizens. There will be many lessons for everyone in Canada and indeed around the world from this pandemic and our responses to it. And these lessons learned will help ensure that all levels of government can make the changes needed to ensure we are ready to respond to future public health threats. Thank you very much.
Thank you.
Good
Minister
afternoon.
Hanna would like to-
Sure, thank you. Good afternoon. I am pleased to be here with Ministers Hajdu and Miller to comment on the Auditor General's report. Au début de la pandémie, Services publics et approvisionnement Canada a adopté une approche agressive en matière d'approvisionnement pour répondre aux besoins immédiats, émergents et à long terme des provinces et des territoires en matière de fourniture et de l'équipement médicaux, comme l'avait demandé l'Agence de la santé publique du Canada. Il s'agissait notamment d'acheter un gros d'importants d'articles de pays et des fournitures médicales tant au pays qu'à l'étranger. Procuring the goods and services required to combat the pandemic, particularly in the first 100 days, was a whole of government and around-the-clock effort undertaken in an era of extremely volatile and tight supply chains. I appreciate the Auditor General's recognition of the significant work undertaken to secure supplies and equipment during a period of unprecedented global demand in order to support Canada's response to the pandemic. That work has allowed us to secure over 2.7 billion articles of PPE and medical supplies for Canada's frontline healthcare workers. In the first months of the pandemic, given the urgency of the situation to procure PPE in a rapidly changing and competitive environment, PSPC needed to take decisive action to secure a supply of life-saving PPE. Dans le rapport d'aujourd'hui, le vérificatrice générale reconnaît que SPAC a accepté des risques atténués, ce qui a permis d'obtenir rapidement les fournitures nécessaires. Le rapport formule également une recommandation de l'intention de SPAC concernant la nécessité d'effectuer des vérifications de la solidité financière des fournisseurs avant d'attribuer des contrats prévoyant des paiements anticipés. Nous acceptons cette recommandation et remercions encore une fois la vérificatrice générale pour ce support et rapport. Ces conseils et ces recommandations continueront de guider notre réponse actuelle à la pandémie et aideront à préparer le Canada à répondre à de futures situations d'urgence. We accept this recommendation and thank the Auditor General once again for this report. Her advice, her recommendations will guide our ongoing response to the pandemic and help to prepare Canada to respond to future emergency situations. I would also like, from the bottom of my heart, to thank my officials at PSPC for their tireless efforts to help protect Canadians from COVID-19. These efforts have been ongoing for over a year now, and I have watched as public servants work day in and day out for the benefit of our country at large, and I am extremely grateful. Thank you.
Minister Miller, over to you.
Kwekwe, Nusakut Tensei, hello, bonjour. Before I begin, as I'm in Ottawa, I would like to acknowledge that I'm on the traditional territory of the Algonquin Anishinaabe people. Depuis le tout début de la pandémie, Service aux Autochtones Canada s'est rapidement mobilisé puisque nous savions que les peuples autochtones feraient face à des risques plus élevés. Notre priorité absolue est et a toujours été la santé, la sécurité, le bien-être des Premières Nations, Inuits et Métis, et nous n'avons jamais perdu cela de vue. J'étais ravi de voir la vérificatrice générale du Canada reconnaître nos efforts dans son rapport sur les ressources en santé dans les communautés autochtones. Le ministère a joué un rôle critique en approvisionnant de l'équipement de protection individuelle pour les communautés et les organisations autochtones à travers le pays et en fournissant des ressources humaines de pointe dans le secteur de la santé. Nous sommes allés au-delà de nos responsabilités habituelles, conventionnelles, afin d'adresser des besoins critiques sans conflit de compétences. Notre gouvernement partage l'observation de la vérificatrice générale concernant le fait que les communautés autochtones doivent avoir l'approvisionnement et le personnel qu'ils ont besoin afin de protéger leurs membres contre la COVID-19. We acknowledge each of the Auditor General's recommendations, which will guide our ongoing response to COVID-19 and future public health emergencies. In fact, we've already taken actions in the first month of the pandemic. We identified the need to have an efficient system to manage PPE requests, as the volume would be beyond anything we'd seen before the system was implemented in September, midpoint in the audit period. As the report notes, we did take immediate steps to get PPE into the hands of Indigenous communities, responding to over 1,600 requests from March to December 2020, on average within 10 days, despite global shortages and shipping to remote locations. I'm grateful to the Auditor General that the Auditor General also noted our success in finding solutions to personnel shortage. We streamlined the process for hiring nurses and contracted private air transportation services to get health professionals to 51 remote communities. However, we do know we can always do more. And the real success story of this pandemic is that we are doing all of this hand in hand with First Nations, Métis, and Inuit leaders. We've asked them what they need and how we can continue to support them. Les leaders des communautés autochtones ont été très ouverts et transparents avec mon équipe et moi, et j'aimerais d'abord et avant tout les remercier pour leur force et leur résilience devant cette menace significative à la santé publique. Miigwech, Nakumik, merci. Thank you et merci.
Merci. Nous allons maintenant répondre aux questions des journalistes, une question et une question de suivi. We'll now take questions from journalists, one question and one follow-up. Operator, first question, please.
Thank you, merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. And the first question, la première question, Ryan Tumilty, the National Post. Please go ahead.
Yeah, good afternoon. This question is for Minister Hajdu. I'm wondering when you first became aware that the national stockpile was so inadequately resourced for the scale of the pandemic.
Well, thank you very much for the question. And I will say that it really wasn't just about the stock that was contained in the stockpile, but it was about the processes that the national stockpile were using to support provinces and territories. And early on in the pandemic, as we were trying to ascertain from provinces and territories what their anticipated needs would be, it became clear that we didn't have the information that we needed and that we needed to act quickly. And so, working in collaboration with my colleague, Minister Anand, we began to put together an order for Canada based on what we estimated we would need to be able to support provinces and territories, and assumed essentially that we would need everything. And since then, we've come a long way, as the Auditor General's report has indicated, that we have now systems and structures that allow us to better inventory what we have and to better collaborate with provinces and territories in terms of anticipating what their needs might be, either in a particular threat or in an ongoing basis. And so I think the lessons learned have been that we needed, and we, as you can see, have taken many steps towards a much more robust system of really understanding what's in the nest, what the anticipated requirements or needs might be of provinces and territories, and ensuring that we have a very good and strong line of sight on how to get that product quickly.
Ryan, do you have a follow-up?
Yeah, I do. I'm wondering, Minister Hajdu, if you can tell us what your expectation is, given that the stockpile was not adequate for this pandemic, what is your expectation of what it should be going forward and how you're going to achieve that? What should it be able to respond to in future?
Well, thank you for the question, Ryan. And I think that that's the work of the Public Health Agency of Canada and the work they're undertaking right now. And again, it is really trying to understand what the basic equipment would be that would be required no matter what type of global health threat. You can imagine that the threat from a respiratory illness might require different equipment than the threat from another kind of illness, let's say a bloodborne illness. Nonetheless, there is some sort of standard equipment. I'm thinking of gloves, for example, and gowns and certain types of masks that would likely be required in a variety of different kinds of threats. And so that's the work of the Public Health Agency of Canada right now, is understanding how they manage that stock, what is a sufficient amount, and how we ensure that that stock is rotated so that we don't experience, for example, expiring stock without an appropriate use for that stock. And so, again, the Auditor General has provided very useful feedback, and the agency had already pursued some of those suggestions, obviously working through the last several months in a very urgent way. But nonetheless, the feedback from the Auditor General will fine-tune the work that the agency is undergoing right now.
Thanks, Ryan. Operator, next question, please.
Thank you. The next question, la question suivante. Christian Noël, Radio-Canada, la parole est à vous.
Bonjour, mesdames, messieurs. Merci beaucoup de prendre nos questions. Monsieur Miller, j'aimerais vous poser une question en lien avec un sujet différent du rapport de la vérificatrice générale. Il y avait la motion du Bloc québécois aujourd'hui concernant la loi 96 au Québec. D'abord, j'aurais aimé savoir, vous pensez quoi de la motion? Vous êtes-vous opposé ou étiez-vous d'accord avec la motion? Et pourquoi?
Merci pour la question, Christian. Écoutez, toujours bizarre que le Bloc québécois doive apparaître devant la Chambre des communes pour demander quelque chose qu'on sait très bien existe, notamment que les Québécois forment une nation au sein du Canada et que la section 45 de la Constitution, c'est-à-dire la formule d'amendement, donne aux provinces cette compétence exclusive. C'est écrit sur noir et blanc. C'est toujours sujet aux modifications qui puissent exister, que ce soit dans la section 41 ou 43 de cette même Constitution du Canada. Donc, c'était de l'évidence même. On sait très bien que la Constitution du Canada accorde des protections très importantes à notre identité en ce qui a trait aux minorités. C'est quelque chose que nous allons toujours défendre comme gouvernement. Donc, voilà ma réflexion, Christian.
Parfait. De mon côté, à moi, la fin de la réponse, il y a eu un petit peu de friture dont je vous demanderai, avant de vous poser ma deuxième question, s'il vous plaît, de répéter ce bout-là, juste pour être sûr que je l'ai comme il faut.
Ben, je ne sais pas où ça a coupé, Christian, mais écoutant la motion
c'est l'évidence.
elle-même, oui, la motion elle-même est une évidence, est une réalité que le peuple québécois forme une nation au sein du Canada. C'est clair que la Constitution du Canada donne le pouvoir aux provinces, non seulement le Québec, des compétences exclusives en ce qui a trait à la section 45, qui elle-même, dépendant de la matière en question, est sujette aux clauses 43 et 41 de la même Constitution. Et donc, comme gouvernement fédéral, nous allons toujours défendre la Constitution, incluant les droits qui sont si fondamentaux dans la charte, ainsi que les droits qui sont inscrits pour les minorités à travers le Canada.
Merci beaucoup. Pour ma deuxième question de suivi, est-ce que vous craignez que cette démarche au Canada puisse mener à une certaine érosion des droits linguistiques? Et si oui, de quelle nature?
Ben, écoutez, le droit et le devoir de protéger, par exemple, le français au Manitoba incombe à la fois au gouvernement fédéral ainsi que le gouvernement de la province du Manitoba. C'est le même constat en ce qui a trait à la protection, que ce soit la protection du français ou les droits des anglophones au sein du Québec. C'est au gouvernement fédéral de protéger des droits qui sont inscrits, qui forment la base de notre Constitution, qui sont inscrits noir sur blanc, mais aussi au gouvernement du Québec de protéger des minorités. Donc, c'est un projet de société que nous appuyons. On sait que le français, dans la mer d'anglais qui existe en Amérique du Nord, est menacé. C'est la raison pour laquelle le projet de loi, le projet de Mme Joly, pour que le gouvernement fédéral assume sa responsabilité, son rôle dans l'identité nationale de notre pays, c'est-à-dire de protéger le français à travers le Canada, est si important, c'est-à-dire de travailler dans notre champ de compétences. Et évidemment, le Québec contient travailler dans son champ de compétences. La Constitution, encore une fois, a des protections réelles importantes en ce qui a trait aux droits fondamentaux des personnes, que ce soit de la liberté de religion, d'expression, mais aussi des droits linguistiques des minorités. Et évidemment, je nomme les droits des minorités anglophones au Québec.
Merci, Christian. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. La question suivante, the next question is from Marika Walsh, the Globe and Mail. Please go ahead.
Good afternoon. For Minister Miller and Minister Hajdu. I'll start with Minister Miller. I'm just wondering if you can explain why the department didn't follow its own 2014 policy on the procurement of personal protective equipment. Why wasn't that done given that you had that policy in place?
Well, Marika, I became minister in November of 2019 and had about a couple months before a global pandemic broke out. I know what existed within the ministry at that time, and I know the incredible work that my team did to reach out to communities to assess needs. And let's remember a great period of uncertainty as to the impact of the virus, its nature, its spread, and its potential to devastate Indigenous communities. So the first thing my team did was a communications exercise to talk to health managers in communities, health leadership, and see what the needs were. And we moved, as the report stated, quite quickly to fulfill those needs. Now, at the beginning of the pandemic, that was very much in and around PPE for essential workers. And as the report notes, the department adapted and overcame challenges, I think, that existed across government in procurement. The work that my colleagues, ministers Anand and Hajdu, did as well at the national level is a testament to that. This isn't about being perfect. It's about realizing what what the cards that have been dealt to us, and to work with providers in record time, trying to outpace a virus that moves faster than government, and that's what we did. We did so as we reflected on the impact of the first wave, apprehending a very dangerous second wave for Indigenous communities, and that included a call out for a very rare and important resource, and in fact, the heroes of this pandemic, which is nursing and paramedics, to make sure that we had enough resources to face a very dangerous second wave, and then in the deployment of the vaccines, which obviously this report doesn't cover. But I look at this in its totality. I look at the moves that we made in reflecting on what had gone right and wrong during the H1N1 pandemic, and moving quickly to make sure we not only gave communities the financial capacity, but the physical resources that are difficult to reproduce on a smaller level than the government of Canada, and that required an immense amount of work and an immense amount of work with Indigenous communities in particular, who have done an incredible job at protecting their people.
Okay, I'm well aware you weren't there when the policy was created, but I'm presuming that at some point you've asked why that policy wasn't followed. If you did, and if you got a response, please do let us know. But my second question is for Minister Hajdu on the response to this report from the Auditor General. The response from PHAC in the report says the plan for the National Emergency Stockpile will be completed in 1 year. I'm wondering when you can say when it will be fully implemented, and when the stockpile will be fully overhauled and actually ready to respond to a pandemic.
I would say there's two parts to that. I think the PHAC is, what's the saying, running and chewing gum at the same time, because in fact they are responding right now to a global pandemic and are providing support to provinces and territories in distributing PPE as required, but also rapid tests, but also, for example, responsible for the distribution of vaccines across the country. And so they are working in extremely efficient ways to support the provinces and territories with immediate needs. And the planning work is really about how to ensure that we have a national stockpile that will be responsive and flexible enough to be able to expand quickly, but also to have the right equipment, as I mentioned earlier, in place that could be considered standard equipment, regardless of the kind of threat, public health threat. And then the other aspect of managing the stockpile is ensuring that we understand how to have the equipment regularly maintained, because of course, depending on the equipment, of course, it ages, it expires. There has to be a plan for that. There has to be a plan on logistics and warehouses. And that is the comprehensive forward-looking plan that the agency is doing right now. So as we have learned these lessons in responding to COVID-19, it's given a very strong foundation for the kinds of reflections that the agency needs to have about an ongoing maintenance of a national emergency stockpile that's robust enough and flexible enough to be able to respond to any public health threat, regardless of how it presents.
Thanks, Marika. Operator, next question, please.
Thank you. The next question, la question suivante est de Boris Proulx, Le Devoir. La parole est à vous.
Bonjour. On a rapporté ce printemps que le gouvernement a fait un appel d'offres pour 30 millions de blouses d'hôpital jetables de trop. Et on apprend ce matin que votre gouvernement ne savait pas exactement combien de matériel de protection il avait dans sa réserve d'urgence. Je me demandais si ça a un lien, si le fait que votre réserve nationale d'urgence avait des problèmes au niveau de sa gouvernance a fait en sorte que vous avez peut-être fait des appels d'offres de trop, tout simplement, par la suite.
Minister Hajdu, you might be on mute. Minister Hajdu, you might be on mute. Minister Hajdu, you might be on mute.
Patty, I think you're on mute.
Oh boy, all that French. Merci beaucoup pour la question. Dans le début de la pandémie, nous avons savait il y a une autre approche que nous devons. We needed another approach at the beginning of the pandemic because, of course, we knew that we were going to need to understand in real time what the provinces and territories needed. And because provinces and territories have their own stockpiles, and typically, by the way, are responsible for maintaining their own stockpiles to respond to health threats, the national emergency stockpile is really meant to be a backup to that. We knew, though, that because of the rush, because of the demand for this equipment around the world, that we were going to need rapidly a new approach to support provinces and territories. And that's why we embarked immediately on purchasing as much as we could of the kinds of equipment like gowns and gloves and masks that we knew would be used on an ongoing basis and oftentimes in great volume. And so we realized we couldn't use our old approach of getting requests from the provinces and territories to understand what their order might be and then filling those orders. Rather, we had to act rapidly and assume that we would need a high quantity of these kinds of equipment very quickly. And that's where Minister Anand and I worked very closely to make sure that we could really get as many of these products in place for provinces and territories. I think the other piece is that it was very difficult to procure. In those early months, of course, many countries were in the same situation, looking for the same exact items at the same time. And it was clear that the federal government had a much bigger ability to procure than provinces and territories on their own. And so we decided that we would take on that role of buying these products for the country. And we would do so as a way to ensure that no province or territory would run out of these essential equipment. And maybe Mark or Anita, you could add a few words in French.
Oui, Patty a raison ici. Je voudrais ajouter seulement qu'elle a raison, c'était un temps très, très difficile parce que tous les pays veulent avoir le même produit, les mêmes fournisseurs. Donc, c'était difficile de procurer les produits. Donc, qu'est-ce que nous devons faire dans cet environnement? Nous devons acheter les produits de plusieurs fournisseurs et plusieurs chaînes d'approvisionnement. Donc, nous avons acheté des gants, des blouses, des masques, des respirateurs dans les autres pays, mais aussi ici au Canada, nous avons maintenant les chaînes d'approvisionnement pour ces mêmes produits. Donc, ça, c'est le travail de notre département chaque jour et chaque jour l'année passée aussi. Merci.
Merci. En guise de suivi, vous n'avez pas très bien répondu à la toute première question de cette conférence de presse posée par mon collègue Ryan. La vérificatrice générale a été très claire que le gouvernement ne connaissait pas l'inventaire ou le nombre, si on veut, d'équipements de protection individuelle que vous aviez dans la réserve. À quel moment vous avez découvert que vous ne saviez pas exactement quel était l'inventaire?
Merci pour la question. Dans le début de la pandémie, j'ai compris qu'il y a un enjeu avec le stockpile. It was clear that the stockpile did not have sufficient personal protective equipment for the demand that we anticipated was coming from provinces and territories. It was also clear that there was a system that relied on information sharing between provinces and territories. Usually, the stockpile is not the only source of supplies. It's an addition to the stockpiles of the provinces and territories. And yet, as I said, we knew very early on that not only did we not have a clear sense of what we had and what we could provide, but provinces and territories were struggling to understand their inventory as well. And that's understandable because, of course, they have many hospitals, many public nursing homes, all kinds of different settings. And it was very difficult for the country to understand what we had and what we needed. And that's why early on in February and March, we began to prepare this order for the country. I should say multiple orders, many orders, beaucoup des ordres pour le pays. Because, of course, we understood that there would be a global demand. There was a global demand for these items, and that we were going to need to step in to procure as a country rather than 13 different jurisdictions trying to compete in a very competitive market. And that is, I believe, the beginning of the work that we did over the last 14 months, which has become much more streamlined, much more comprehensive. And of course, since then, we have worked diligently to have professional management plans for the National Emergency Stockpile, including logistics experts and warehouse considerations. And of course, the ongoing work is to understand what the foundation of needs are to respond to any global public health threat.
Merci, Boris. Prochaine question, s'il vous plaît.
Merci. La question suivante. The next question is from Zach Becerra with the Saskatoon Star Phoenix. Please go ahead.
My last name is very tricky. I apologize for that. My question is for Minister Miller in regards to the Auditor General's report on PPE procurement for Indigenous communities. I heard from the Auditor General that we do not yet have kind of an accounting of how money that was given to Indigenous communities for their own procurement was used. I'm wondering if we can expect kind of a full accounting of that when that comes in the summer, so we have an idea of how this funding helped Indigenous communities and whether it was sufficient.
Yeah, Zach, I think good question. It is a, I think we have to recognize that we're not out of the third wave yet, and we are deploying financial instruments in record speed to keep people safe, to get the vaccine into arms, and with good results. My focus right now is on that. I think at some point people will want to get a sense of where monies went for most Indigenous communities. There are processes ongoing. I can't really comment to you on the timing of those. You'll recognize that the way financial supports were we can talk about financial and physical supports or material supports in two different categories. I guess for purpose of the audit, you're interested in where financial resources were used. And then you kind of have to break that up into categories. One, the ones that were distributed to communities with lots of flexibility for their programs to protect their own people. And that's largely falls within the Indigenous Community Support Fund, as well as a parallel fund for Indigenous organizations that can be urban organizations or also tribal councils, whether they're administering those funds for their people off reserved or as a collective effort. So I think there's a few distinctions in there. I don't know the timing on it. I suspect there will be obviously some transparency of some level to get a sense of how those monies were used, particularly so we can get a sense of how we develop good public policy, health policy going forward, and which ones can be transported easily into a context that is outside COVID. But for now, and certainly the budget highlights it, I'm still focused on deploying community support funds 4 and 5 to make sure people stay safe and then can bounce back from this world epidemic.
I have another question for you, Minister, in regards to something that was more of a side note in the auditor's report, but I found very interesting. The auditor said that up to April 2021, that the rate of hospitalization and death for First Nations on people on reserve was actually lower than the general population. That is totally contrary to what I've heard from ISC staff here in Saskatchewan. It's very much contrary to what I've heard from you and from people in the community. How did the Auditor General land at that number, and do you disagree with it?
Sorry, what's the mortality rate is lower? And or hospitalization?
Yes, mortality and hospitalization.
Just I was paying attention, Zach. Just repose the question so I'm clear about what it is, because I do want to answer that in a comprehensive fashion.
No, more than fair. And the exact question I'm asking is sort of right at the top of the report. And what it talks about, I'll actually read out the exact text to you. It says that compared with the general population, First Nations people living in on-reserve communities were less likely to be hospitalized or die from COVID-19. The hospitalization rate is 4.5% compared with 7.5%. And the mortality rate is 1.2% compared with 2.2% as given by the auditor.
Yeah. So and we have to circumscribe this in the context of risk and vulnerability. I mean, early on in the pandemic, when we were reflecting on the ongoing impact of the first wave, which let's recall only impacted in terms of people that got COVID about 400 people in the on-reserve context, and that's without talking about the off-reserve context, which is important to address as well. But those are the numbers we understood and could get a better sense of. We were looking at, what is that vulnerability? What is causing that increased vulnerability and risk? And what we looked at were numbers that were coming into us from the South in the US from the CDC, which were showing numbers in the attack rate of about a vulnerability of 3.5 to 5 times greater. And that's kind of scared us as to what the impact could be for the second wave, which is why we took a take stock and kept mobilizing resources. What's important to realize is that the vulnerabilities exist from historic underfunding in housing, under investments in health resources, and remoteness as well. But there are many communities that are close to large urban centers that are understaffed as a comparable to their similarly situated non-Indigenous community. That is all to say that when we looked at the mobilization of resources and the work that Indigenous communities did with the resources they got and to protect their people, they took it very seriously, and they took measures to ensure that ultimately mortality is lower. It's not something people enjoy talking about, but it is lower. It's now at 60% of the non-Indigenous mortality rate in Canada. That isn't the case in the US. If you look at the numbers in the US, it's a much lower segment, younger segment of the population, and it's essentially double the mortality. So it's not to say the vulnerabilities don't exist. It's just the communities reacted well with the resources they had and implemented their pandemic plans with some success. And so when you look at numbers that are a little less positive, for example, the best data set we have essentially comes out of BC and Manitoba. You do see disproportionate hospitalization rates, disproportionate mortality rates, and disproportionate rates of Indigenous people in ICUs. Those are ones going into urban settings. So the on-reserve portrait is positive, but it's a testament to the work that's been done and the extra precautions that Indigenous leadership took and the seriousness with which they approached both the first, second, and now the third wave. But you need to kind of take a step back and look at what that impact rate is in on and off reserve in the far north. And also recognize that when COVID gets into an Indigenous community, you have to deploy far more resources than you would should it happen in an urban center with better access to medical staff, supplies, and medical care. One particularly telling example is the amount of work that all levels of government and Indigenous leadership have had to deploy to the recent spread in Iqaluit, which has involved $19 million of alone in investments from Indigenous Services Canada to a spread that was essentially caused by by one person, and then took all the precautions, and it got out of there, and it spread within the community. So I did want to couch my answer by saying that yes, the mortality rates have been lower, but certainly when you take a step back and you look at the impact on Indigenous peoples, it has been quite significant.
Thank you, Zach. Thank you, Minister Miller. Unfortunately, that's all the time we have for today. So this concludes today's press conference. Ceci conclut la conférence de presse. Merci.